Dr. Dhrubaa Ghosh. She is the lead healthcare advisory, Thinkthrough Consulting. Her background is also as a virologist in the public health domain, worked as a faculty at the National Institute of Virology, Pune. So she is perhaps somebody who can tell us a little bit more about the trajectory, what we are about to witness in the country. Doctor, thank you so much for speaking to us. It's a pleasure to have you on the broadcast. I want to get your thoughts. All of us in the country are wondering right now, what is the next course of action going to be? The numbers are increasing of the confirmed cases. Next 1 week, how do you see the trajectory in India?
Okay, well, yes, the concerns are right now with the numbers. The numbers are increasing, but I think the government has taken the right step with this lockdown in place. And if people abide by this, strictly follow this, then definitely it's going to pull down the transmission curve, or rather I would say flatten the curve to some extent and keep the transmission under control. This is one. And regarding the migrant workers that I was
Doctor,
listening
I'm sorry to interrupt you, but is it possible for you to face your camera so that people can hear you?
Yeah,
and
sure,
see you
sure,
properly?
sure.
Yeah.
Sure.
Thank you.
So as far as the migrant workers are concerned, I think it's a good idea to, not move them. They must stay back. They must be provided some shelter homes. There are a lot of charitable organizations which can play a role at this point of time, but through community kitchens, etc.
Yes.
But it's not a great idea to move them right now when there's an effort to, bring down the transmission by the lockdown.
Right.
So yes, we need to follow the guidelines, and we need to follow what the government has asked us to do.
Yeah.
If we do our bit, I think we'll be very much in control.
Dr. Ghosh, there are some good examples across the world, like South Korea to look at, but there are also examples which we do not want to replicate, say in Iran or in Italy, the way it happened there. I want to specifically understand from you the nature of this virus and the trajectory based on the international experience it is likely to take in India in the next 1 week. Sharp spike in the number of cases is what all the experts are saying. What are the numbers that we are looking at right now? Any predictions that you can put forward?
Well, it would be very difficult to predict as of now. All I can say that we are in the exponential phase, that is the third phase. So we are expecting a spike in the number of cases, and that is why the government has put this lockdown in place. However, I think it would be much easier to predict the numbers if the testings happen, which right now seems to be a challenge for every country, not only India, because the problem is that there are no affordable, rapid, sensitive diagnostic kits available for mass screening. And therefore, once, if the numbers are not in place, it becomes very difficult to predict.
Right.
So right now, I think there should be an effort, and which the government of India has been making towards, rolling out more kits, affordable kits. There's one such company which has been, approved by ICMR. That's my lab. And they are going to roll out 1 lakh kit. But that is not enough for India because it has a staggering population of 1.3 billion. And if 60% were to get infected, it would be at least around 780 million. So we need that much of screening. So we need a lot of affordable kits in place.
All right. That's a very important point, Doctor, that you're making. Thank you so much for sharing your expertise with us on the broadcast. And as you rightly say, we need a lot of screening in the coming days. The third phase is what we have entered. That's what the expert is also pointing out. Social distancing, what the privileged in our country can do, we must do it. Do not ignore it. Now, the lockdown also saw a massive exodus of migrant laborers who wanted to return to their home. But because there is no public transportation that's shut across the country,